Wonderful. Thank you so much, Emily, and welcome everyone to today's webinar of our regional learning platform on care reform. We're really excited to have this discussion today. Just some housekeeping things in the beginning. The webinar is being recorded, and we'd kindly ask that you please introduce yourselves in the chat box. If you could please share your name, your country, and who you work for. This would be very helpful to us, as we're always very keen to hear, the background of the participants that are joining us for this webinar and other webinars that we convene. And if you could also please mute yourselves, this would be greatly appreciated. And we do have interpretation services available today. So specifically, you'll see the interpretation icon at the bottom of your screen. So please hover over that and then choose the language that you wish. And then very importantly, please mute your original audio. This also goes for if you would like to listen or speak in English. This is important so that the interpreters can hear what you have to say. Before we get into the topic of today's webinar, which of course is focused on integrated approaches to care reform with a focus on social protection and education linkages, we wanted to share a bit of background about the regional learning platform, particularly as we have some participants today joining us who may not have engaged with the platform before. This regional learning platform on care reform was set up by UNICEF Eastern and Southern Africa with contributions from Changing the Way We Care. And it really is a platform through which we hope to provide an opportunity for policymakers and practitioners across the region and beyond to exchange learning on care reform. So there are a number of aspects of this platform. We have a regular newsletter. We have regular webinars, such as the webinar that we're convening today. We produce policy papers, videos, case studies, and very importantly, we have a help desk, which allows anyone in the region from government or UNICEF to request support on care reform. And we're going to share some links in the chat box so you can immediately access these different resources, including our YouTube channel, and very importantly, also a link to a short form through which you can join the mailing list for the mail out, the newsletter that we send out every month. This usually includes a short 5-minute article on a specific topic and also shares any new regional or global developments or progress in relation to care reform. One thing to mention is that our regional platform is now in its 4th year. We have a public rolling work plan, the link to which we're providing in the chat box. You can take a look at this rolling work plan so that you have an idea of what is planned for the rest of this year. We conducted and completed by the end of last year an evaluation of the regional learning platform. Amongst other things, the focus of this evaluation was to determine the thematic focus of the regional platform and what particular areas we need to perhaps enhance our focus on. So this has very much informed our work plan, and amongst other things has led us to prepare for 2 interactive workshops on different aspects of care reform. So what we have coming up later in the coming months is an interactive workshop on care levers networks that's going to be taking place online on the 12th of June at 2 p.m. Nairobi time. And then we will have another interactive online workshop towards the end of July. It's going to take place the week of the 22nd of July, which will focus on the tools that UNICEF's data and analytics section has developed on enumerating children in residential care and assessing the quality of this care. So we really, based on the feedback we received from the evaluation, we really want to make these truly interactive exchanges, and that means that we need to limit a bit the number of attendees. So if you would like to join one or both of these workshops, please do reach out to our project assistant, Bertha. The email address should be shared in the chat box, and please just let her know if you're interested in attending both or one of these workshops. So as mentioned, we're in our fourth year of this platform, so it's really a pivotal moment for us because we are reflecting on how to take this work forward. And your feedback is really, as participants in this platform, is really critical to help to determine the way forward. So we've prepared an anonymous poll that you will see on your screen, where you can share with us this very important feedback. We are conducting this poll in the webinars that we're convening as part of the learning platform. So once we have about 3 polls completed, we'll be sharing the feedback with you. So I will be giving about 3 minutes now for you to please to complete this poll, and then after that we'll be able to proceed with the content of the webinar. So we take a brief break for 3 minutes to complete the poll, and many thanks in advance for your participation. We greatly appreciate your inputs. I will be back continuing on with the webinar in 3 minutes. Thank you. So thank you so much to all participants for your engagement in the poll that we shared. As mentioned, your feedback is really critical to us. And to participants who just joined, just to mention, my name is Nicola Brandt. I'm a regional child protection specialist with UNICEF Regional Office in Eastern and Southern Africa. And once again, I'm really pleased to welcome you to today's webinar. So let us then really focus now on the content, on the topic of today's webinar. We know that successful care reform really requires collaboration with other sectors. And so based on the feedback that we received from many of you, we will today in particular look at the linkages between care and social protection and care and education. This is really critical as we know that poverty and poor access to schooling are really 2 of the main drivers of inadequate care. And just to give you a quick snapshot of the structure of today's webinar, I will start with a very brief 5-minute overview of the connections between care and social protection. Then we are lucky to have 2 country examples that will be shared, one from Kenya and one from South Africa. After that, I'll share a very brief overview of the linkages between care and education, which will be followed by a panel discussion, which will be moderated by Leon Mwani, our Chief of Child Protection in Rwanda, where we will hear country examples from Rwanda and Uganda. And that will then be followed by a 15-minute Q&A, which our colleague Emily from Child Frontiers will be moderating. One thing we wanted to emphasize, please don't wait until the Q&A to share any comments, reflections, or questions. Please feel free to enter those in the chat box throughout the session. This can then help inform the Q&A that Emily will be moderating, and in some cases maybe we'll already be able to respond to your questions in the chat box. So please do keep those coming and don't wait until the Q&A. So with that, I'll briefly outline a bit the linkages between care reform and social protection, and then very importantly, we will move on to the country examples. And I'd encourage Emily, if you can click through all of the pieces of the slide so we have it right on the screen. Thank you so much. Very briefly, in terms of what we are actually referring to when we refer to social protection, it's really important for us all to be aware that really all of us have different vulnerabilities in our lives and that we have a right to be supported. And so this slide, and of course we're going to circulate this along with some other resources and details because of course we can't cover everything in 5 minutes, but this slide attempts to illustrate really how across the life course, really everyone needs access to social protection, from nutritious diet and health services, particularly during pregnancy, to being able to afford to go to school to prepare for the future, for persons with disabilities in particular, to be able to access facilities, support, and services. And another example being that we really need pensions when we are elderly and are unable to work. Next slide, please. So here in the next slide, we are sharing, the formal interagency definition of social protection, where it is clarified that this is really about a set of policies and programs that aim to prevent or protect all people against poverty, vulnerability, and social exclusion throughout their life course, as just shown, with a particular emphasis towards vulnerable groups. And what's important to emphasize here is that social protection systems are really designed to help individuals and families during quote unquote normal periods, but to also prepare for and respond to shocks. So that's really important. And we've listed here, and again, this is actually based on a working paper that we as the Learning Platform published back in 2022. An overview of what programs, social protection programs might include. So everything from cash transfers, social insurance, reducing unemployment, improving household livelihoods, and efforts to strengthen the social service workforce. In the next slide, and I won't go into all of the details, but I think it's a very helpful slide in terms of really illustrating the different social protection interventions. And again, this is not exhaustive, but where you can see in terms of the linkages in regard to direct support, financial support, social norm support, and legal and policy support. So this gives you already an idea. So then when we go to the next slide, the key question then is, why then create better linkages between social protection and care reforms? And first of all, there are some really critical overlaps between social protection and care systems, and this illustrates it quite well, where we see that really both systems are really aiming to reduce vulnerability and exclusion, that both take a systems approach, and that both combine poverty reduction strategies with efforts to address other aspects of vulnerability, that often the target is the same. It's the same vulnerable children and families, and very importantly, that the same frontline workers often are involved both in care and social protection programs. And of course, there's a very significant discussion around this, and we will set up a separate webinar just dedicated to this, how on the one hand, social protection programs can be a real entry point to strengthen child protection systems and to strengthen the social service workforce, but kind of on the other side of that coin, if the social service workforce isn't well defined, there's a real risk that the very limited resources that social workers have are then taking them away from being able to really work on case management, and that their time is really uh, fully dedicated to cash programs. But this is something that we really intend to discuss in a separate targeted webinar. So then going forward, to continue that point on why it's critical to create these better linkages, what is of course really key is that social protection addresses key drivers of family separation and abuse and violence. So social protection programs often reduce poverty, which is a reason for family separation and violence in the home and in the region. Of course, what we have to acknowledge here is that the causes of separation and violence in families are very complex, and that, of course, just household economic strengthening through social protection will not fully eliminate, inadequate care, that additional services and support are required, but it is a really key instrument in addressing both family separation and abuse and violence. There's also evidence in the region that social protection programs have a direct positive impact on children's care, and we will be discussing that in greater detail throughout this webinar. And then also very importantly, there are real risks associated with not considering children's care in the design of social protection programs. So just to name a few examples, poorly designed social protection programs can create violence and conflict in the family, for example. If resources are distributed unevenly between children and the family, social protection can really increase stigma and discrimination against children in kinship care. And as mentioned, there can really be this challenge for the social service workforce that I already discussed previously. So how then do we create better linkages between social protection and care reforms? There are several examples that we're listing here. In light of time, I won't go through all of them, but really critical is to really gather evidence on the linkages and to consider how information and data management and monitoring of systems used by both sectors can be utilized to more effectively monitor outcomes. Coordination bodies are really critical in order to maximize linkages between the two sectors, and again, to together really consider the role of the social service workforce in care reforms and social protection, and how to build the capacity of this workforce to fulfill these roles is key. And of course, to include reference to social protection and care reform strategies, and you see some more details there. I wanted to conclude with the final slide where we provide a few details on how to consider care in the design of social protection programs. So one is in respect to goals. So evidence has shown that it's really critical to explicitly include improvements in care as a goal of relevant social protection programs. So we see in the region evidence that this explicit inclusion is really critical to really then be able to improve care as a goal. Then when it comes to targeting, it's critical to target families that are vulnerable to inadequate care. So when we consider, oh, sorry, I think if participants can please mute themselves, or if maybe one of the administrators could mute. Thank you so much. So in terms of targets, when we look at the families that are to be targeted, to really consider those that are vulnerable to inadequate care. So if we look at our region, in particular, young mothers, but also elderly grandparent carers are key. And here it's also really important that the support is really tailored to their needs. And then the final point, what we see throughout the region, but also elsewhere, is that really social protection programs are less likely to achieve positive outcomes for children if they're purely focused on material need. So really cash plus programs have really shown the criticality to be able to provide additional services and support, and how this has really led to concrete results for children. And of course, there are some very critical examples from our region here. So those were some quick reflections we wanted to share. We wanted to give a quick, 5-minute overview to set the ground then for the country examples that will be shared, and that's really what we want to focus on today, to have as concrete as possible sharing of experiences throughout the region. So as mentioned, we're lucky to have 2 country examples, one from Kenya and one from South Africa. So we're going to begin with Kenya, and I'm very pleased to welcome Mr. Hoyd Sadia, who is in charge of the Alternative Family Care Unit of the Directorate of Children's Services in Kenya. I hope Mr. Sadia can hear us, and we're very much looking forward to his reflections on how the Kenyan social protection system is being targeted at vulnerable families to prevent separation and support reintegration. So, Mr. Sadia, over to you. Thank you.
Good afternoon, colleagues. Are you able to hear me?
Yes, we hear you very well. Thank you.
Yeah, my name is Mr. Imbai Hudson. I will be doing a presentation from Kenya, standing in for the director, Mr. Hoyd Sadia, who will be joining this meeting later. Please allow me an opportunity to present. We are discussing about inclusion of care cash transfer program in implementation of care reforms within the Republic. Next slide. So as a country, we realize that we have the National Care Reform Strategy that is giving a blueprint of how matters care reform should be implemented in the country. And we are saying this is focusing so much on change process within the systems and mechanisms that provide for care for children who are separated from families or those who are at the risk of being separated. And therefore, we are focusing on issues prevention so that there is no need for alternative care in the first instance. So care reform has 3 pillars. We are focusing on prevention of family separation, as well as family strengthening, alternative care, so that those children who cannot be within their biological family then should have an option in what we are calling the alternative care. Then for those who are not able to fit within the alternative care, then they should be transitioned to family and community-based care. Next slide. The National Care Reform has 4 main objectives, and it is focusing on prevention of family separation, the 3 pillars that I've just talked about, and the most important of all is to ensure that there is redirection of financial resources and redeployment of personnel from the residential care institution to ensure that there is a safe mechanism under which now these children can be taken to families, of course, where there is support. Next slide. So implementation of care reform is happening at 3 levels. At the national level, we also move to the county level, and as well as the level which is encompassing the state and the non-state actors. And this is being coordinated by the National Care Reform Oversight Division that is based at the headquarters. So ideally, it's happening at 3 levels: national, county, and state and non-state level. Next slide. So care reform in Kenya is being implemented for the period covering 10 years. We are saying from 2022 to around 2032, we should have transitioned all residential care institutions, plus the children within these institutions to family and community-based care. So majorly as a country, we are in the preparation and demonstration phases. Although care reform has been implemented so far in 15 counties as a country, you can, for those of us who are informed, Kenya has got 47 counties. So far, we are implementing care reforms within 15 counties. So we can say majorly we are at the second phase, which is scaling up so that we have the whole country implementing care reforms. So those are the three levels: the first level, second level, and the third level that will be focusing on review and planning. Next slide. So when we talk about cash transfer within the context of care reform, we are looking at the legal framework where we are getting our basis for us to be able to implement care reforms. And so far, if you look at our constitution, Article 43 is acknowledging the role played by families as the fundamental building units within the society. So our family has been given a lot of primacy in looking at issues care reform. We also have the new act, and Section 12 focuses so much on social security, and it's looking at all those care options, things to do with the adoption, guardianship, and so on and so forth. We also have the backing of the Social Assistance Act that was passed in the year 2014. We also rely so much on the alternative care guidelines that came about in the year 2014. And of late, we have the National Care Reform Strategy that is running from the year 2022 to 2032. Next slide. So how did we start mainstreaming cash transfer in the context of care reforms? We are saying it all started with the advocacy by partners. UNICEF, we have partners like Legatam, Lumos, SOS, that supported the DCS in championing the inclusion of care reforms within the social protection in what is being called the Inua Jamii Cash Transfer Program. So there was a directive coming from the Principal Secretary in the Ministry of Labor, dated that 1st August 2023, that directed care reform programs, be it the universal child benefit, school transport, all those, to ensure that they are considering children that are coming from these alternative care options. There was need, again, to look at the targeting criteria, because the one that was existing was in operation from the year 2004, and it was biased towards children having certain vulnerabilities. So the reason for widening, or rather looking at the criteria, was to ensure that now we are incorporating new vulnerabilities so that all children within these care reform options, these alternative care options are being considered. So the review was necessitated by the need to consider other vulnerabilities that affect children who have been separated or those at the risk of separation. Next slide. So if you can look at the slide, you will see we are talking about the objectives of social protection in Kenya, and they are highlighted there. First of all is to strengthen families and prevent separation of children from their families, to increase enrollment, attendance, and transition of children in basic education, reduce the rates of mortality and morbidity across all ages, especially of children under the age of 5 years, particularly through increasing the uptake of immunization, growth monitoring, vitamin A supplements issuance, as well as looking to matters focusing on food consumption as well as food security. Encourage civil registration of children and caregivers, especially registration of persons with disabilities, so that they are able to acquire these important documents to assist in access of essential services, either from government or even outside government. The other reason was to improve the household knowledge and appropriate case management for individuals with special needs through coordination and referral with other service providers. And lastly was to provide support to children, especially those in alternative form of care. Next slide, please. So what are the programs within the social protection in what is called in Kenya Inua Jamii? Inua Jamii actually is focusing on ensuring that families are elevated to another level whereby they are able now to stand on their own. So we have three cash transfer programs. The Other Persons Cash Transfer Program that is targeting individuals who have attained at the age of 70 years, and this is a universal program. We have cash transfer for persons with severe disability and cash transfer for orphans and vulnerable children. Next. So we looked at the eligibility criteria that we said was in existence since the year 2004. So it had to be reviewed so that then it is encompassing the existing current vulnerabilities, so that then we are able to bring so many beneficiaries on board. So it looked at a child living permanently in an extremely poor household, a poor household with an orphan child who has lost one or both of his parents, a household headed by a child and who must be connected to an adult caregiver living outside the household. Here we are focusing so much on children that are being supported to live independently within the communities. We are also focusing on child-headed households. The other was a poor household with a child living off the streets, begs or works in the streets, but returns home in what is called to be they call as for lack of a better word. Then a poor household with a child or caregiver who is chronically ill and unable to perform duties. Next. A poor household or a vulnerable household with a child mother. We realized that teenage pregnancy is also a major issue, and therefore we needed to widen the criteria so that then we are able to encompass this important category of children. Also, a household whose members have been residents in a particular location for more than a year, a poor household with a child or a caregiver with a disability, a poor household with all those conditions that we are looking at. And maybe we can move to the last slide. We are looking at lessons learned so far during the implementation and as well as reviewing of the harmonized targeting tool. And we are saying that there's a need to enhance referral pathways in the social protection system so that the system is able to interact with other social programs within the country. And we are looking at the Child Protection Information Management System, the enhanced single registry, and other governments as well as non-state actors. And also there is need for strengthened collaboration amongst partnership at all levels. Then we realized that capacity building for the agencies involved is very crucial in the administration of social protection within Kenya. Thank you, and over. I invite questions if there are.
Thank you so much, Mr. Abai. Really appreciate very much this presentation on the linkages of cash transfer to care reforms in Kenya, and thank you so much for stepping in for your director. And really encourage participants to please share any reflections or questions in the chat box, so that we can include these in the Q&A and also potentially already respond to any questions you might have. In interest of time, we'll quickly now travel to South Africa, and I'm really pleased to welcome Suzanne Klulo, who is the Child Advocacy Manager of Cindy, which is the Children in Distress Network. And Suzanne will be sharing with us some reflections on how the South African social protection system is supporting kinship care and foster carers. So with that, I turn it over to Suzanne. Thank you.
Thanks, Nicola, and thanks so much for having me today to share a little bit about our experience. As Nicola mentioned, my name's Suzanne, and I'm representing the Children in Distress Network based in South Africa. And today I'm going to be sharing some lessons around social protection and kinship care. So in 2016, I don't know, there we go. Sorry, I was having trouble changing the slides. In 2016, we conducted some research around social protection and children's care. Children told us during that research that the main things that were important to them were to be loved and cared for and supported, to belong to a family and to feel safe in their emotional and physical spaces, and to be listened to and respected. And what we found from our research is that, as Nicola mentioned in the introduction, that cash transfers can actually really contribute towards these sort of softer outcomes for children. We know a lot about how it supports education and access to healthcare, etc., but there wasn't so much known around how it supported children's well-being and care. And so our research, which we did actually with other family members in 3 countries in Africa, really showed some strong outcomes in terms of how social protection programs can look at that supporting of children's care and also to prevent family separation. But we also know, as Nicola mentioned, that when cash transfers are combined with other programs, that they also have stronger outcomes. So what the caregivers also mentioned during that research were that they didn't only need access to a cash transfer, what we call a social grant in South Africa, but they also needed access to a range of other promotive and prevention services. They needed options to formalize their parental rights as responsibilities as kinship caregivers. And they also needed access to a responsive child protection system. So when we're looking at how cash transfers or social protection systems can strengthen children's well-being and care, it's really important that we look at how they integrate with other systems. And when we share the example from South Africa, we have a legal system which is overseen by a constitution, but it also recognizes customary and statutory law within our country. So we have about 39 million children living in kinship care, of which 36 million are living with other family members based on customary law arrangements that are about intra-family arrangements and decisions. And those children have access to a range of social protection services, which is designed to take into account the fluidity of their care arrangement. So that might mean the child moves between caregivers and isn't always in the primary care of only one person. So the grant is designed to follow the child rather than the caregiver. And we have about 13 million children in South Africa receiving this grant. It's called the Child Support Grant, and it is valued at about 530 Rand a month. Then on the other side, we have about 300,000 children in kinship care who are living in court-mandated kinship care. So they have been through a legal process to place them with their family member. And this involves a social worker investigation, it involves the court, and it involves regular monitoring and reviewing of that placement. And that cash transfer is quite significantly more. It's just over double what the children in the child support grant receive. It's 1,180 Rand, sorry. And there are approximately 500,000 children receiving that grant, of which 300,000 are in kinship care. So why this big difference? Well, in 2022, when we realized that the HIV crisis was really impacting on children's well-being and care, and we were seeing an increasingly higher numbers of children being orphaned, the Minister of Social Development opened up the foster care system, which is essentially the same as our child protection system in South Africa, to allow orphan children living in the care of relatives to now access the foster child grant. And whilst this was a good thing in terms of the intention, it did lead to some challenges within the system. And we're going to just unpack some of those a little bit more, and how we've thought of a way forward in South Africa to deal with some of those challenges. So when children enter the child protection system, obviously it's a formal system, so that placement then becomes formalized, and it involves gatekeepers making decisions around which children do and don't enter the system. And it also then means that we are using a child protection system to meet the care needs of children. And it may be that actually that system isn't fit for purpose in terms of how it's targeting and accessing those children. So we need to look at whether gatekeepers within that system are consistent and reliable. And we also need to look at whether the purpose of that is, the use of the system is fit for purpose. And what we learned around gatekeeping in South Africa is that legislation must be exceptionally clear. And you can see here, I've listed some gatekeeping clauses across the years in South Africa. And what we have seen is that those clauses within legislation have been interpreted differently by different gatekeepers. And it's caused some challenges in terms of how we understand that and which children enter the system. And we also, the use of the child protection system in South Africa for accessing a support to kinship care has also raised the question of whether all children in kinship care should be in the child protection system, as in, are they in need of care and protection, or are they in need of social protection? So when we talked about the support that kinship carers actually needed, and what they highlighted to us, they need financial support, they need parenting advice, and particularly for older teenage children. And they also need to be able to access parental rights and responsibilities to enable them to do things, for example, including a child on their funeral plan, or accessing medical aid, or even sometimes making medical decisions for those children. And when we question whether it's accessible to everybody when we provide that support to kinship carers through the child protection system, we have 1.2 million children in kinship care who would be eligible, so who are orphaned and eligible to access that higher social cash transfer. But currently, only about 300,000 of those children are accessing it. So that means that actually it isn't accessible to all children within the system because of the way that the gatekeeping clause is used. So does the system meet the needs of the users? We have hundreds of thousands of children who haven't accessed what is legally due to them in terms of the system. But we also notice that including those children in the child care and protection system means that that system has become overburdened. And other children that really do need more attention and have serious childcare and protection needs are perhaps not receiving them because of the administrative burden of including children in kinship care within that system. So this led to what was known as a foster care crisis in the country. And it meant that we had a bit of a messy situation. So children in kinship care, and indeed children in the child protection system, weren't always accessing that adequate social grant because the system was so overburdened. They weren't also accessing the promotive and preventative services that they needed. And options to formalize parental rights and responsibilities were challenged because of certain access rights in terms of which court caregivers could use to access this. And it meant that in essence, our child protection system was not as responsive as it should be. So the solution that we presented and we advocated for within civil society, but we also worked very closely with government because they also recognized that this system was not working to the best of its ability, and that we needed to come together and think of a best possible case scenario for children in kinship care, and also to alleviate the strain on the child protection system so that children within that system could also receive the best type of care and support that they needed. So the solution that we came up with was to create something called a top-up grant. And as you can see, that top-up grant was added to the child support grant, which is very simple to apply for. It does not require a social worker into investigation. It does not require the caregiver to go through the court. And it also does not require ongoing review of the placement. But children within that system can still be referred into the child protection system if that's needed. And that grant is known as the CSG top-up, and it's specifically targeting children who are living in kinship care, who are orphaned and living in kinship care, whose caregivers need more financial support perhaps than children living in parental care, but who were not able to access that care when that was only offered through the child protection system. So I hope that that presentation has helped to show you how sometimes formalization can provide more challenges than we were expecting, and how systems that look at social protection and child protection together need to have a flexibility and also an adaptability that can allow them to change across the years to better meet the care needs of children and carers within the system. Handing over back to you, Nicola, and thanks for allowing me some time to present.
Thank you so much, Susan. I really appreciate these reflections. And I see in the chat box there was already one exchange with Mr. Ibai. And so please, participants, feel free to share any reflections or questions to Susan in the chat box. And you can interact directly with her. And of course, we'll have the Q&A session as well. We're now going to shift gears and focus on education and care linkages. I will very briefly outline the linkages before handing over to Leon, Chief of Child Protection with UNICEF Rwanda, who will then moderate the panel discussion on the topic. So just very briefly to outline, and you will see it on your screen, the linkages. So first of all, the impact of education on children's care. So when we consider the situation of no schooling, there's clear evidence, of course, that this really favors entry into residential care, especially for children with disabilities, and that it also leads to children and adolescents leaving families to work, marry, or to live on the streets. Then when we consider the situation where children are in school but are receiving a poor education and are in a poor school environment, we see as an impact several things. In the school context, children may be exposed to different sorts of violence, both in and around the school. They may feel excluded, and this can really result in an increased risk of family separation. There's also a considerable risk for children who are sent to live with relatives in order to access school. They might find themselves really in situations of inadequate care where they might be discriminated against or even abused, especially if they're living with very distant relatives. And then, as you will see on the slide, in the third line that we have here is being in school with quality inclusive education and a quality inclusive school environment. So here, for example, children have access to counselors or mentors who can guide them, who can refer to social workers and services if and when needed. Children may be learning life and mental health skills, which is so critical, and all of this really also favoring successful reintegration. So that's a quick snapshot. Now, if we then consider the impact of children's care on their education, of course, there is very clear evidence that violence in school affects brain development and capacity to learn. Children in kinship care can have worse educational outcomes than those in parental care. So as mentioned, children living particularly with more distant relatives can be potentially discriminated against or given less educational support. Also in terms of children living with elderly grandparent carers, who may struggle to meet the costs of schooling or may not understand this education system. This can really be a critical issue. And we see that residential care may improve educational outcomes, but of course has really significant multiple negative impacts on child well-being and development. So we're listing here a few of the key joint actions that really would be necessary for education and care planners. If we can go to the next slide, please. Thank you so much. We'll circulate these slides, so I won't go into all of the elements listed here. But of course, what is really critical is that education systems really recognize and address the needs of children in different care settings. Another very critical piece is to truly enable teachers to recognize and support children who have been abused in the home or are vulnerable to separation from families, and to support strong referral mechanisms and collaboration between schools and social services, and amongst other things, to also support setting up school curricula that really teach children their rights and how to protect themselves from abuse, neglect, and family separation. With this, I will turn it over to Leon, who will next lead us through the planned panel discussion. Over to you, Leon.
Okay, thank you, Nicola. I think Nicola has introduced the topic quite well in terms of linkages between care and education. And I think, as she has said, it's quite important for us to recognize the key role that education plays when it comes to decision making in relation to care arrangements for children. We don't have much time left, so I'll be introducing the panel that's going to talk about education and care linkages. So on the panel, we have Mr. Oswald Tuizere, who is with UNICEF and supports with cross-sectoral coordination on disability inclusion in the UNICEF Rwanda country office. We also have Mr. Felicien Turatsinze, who is a country representative for Chance for Childhood, and this is a partner that works with UNICEF on a model pilot that is taking place to look at cross-sectoral integration, essentially to prevent children from separating and also to support family reintegration, particularly for children with disabilities. Then we have Mr. David Adoke, who is the country director for Children's Eye Foundation from Uganda. And we also have Mr. Butanda Shafik, who is a senior probation and social welfare officer in the Ministry of Gender, Labor, and Social Development in Uganda, and is also responsible for alternative care unit. So we are going to have a panel discussion from these colleagues I've mentioned, and we're going to focus on 3 key questions, and I'm going to ask the panelists each to speak for no more than 5 minutes. I think we have 4 of them speaking, and each one has to use at most 5 minutes. So I'll be checking on the time for that. So I'll start on the first question with a question to Chance for Childhood from Felicien. How are education supports being used to prevent separation and support reintegration? So Felicien, you have 5 minutes on this, and then soon after Felicien, David, you can come in again, 5 minutes each on the same question. Over to you.
Yeah, thank you so much, Leon, and the entire group here. Yes, that's a great question you've just asked. And to answer that question, I will start with the key challenges that are found in the child care reform. First of all, when we started doing this job, we could find a number of factors that were limiting children from staying within their families. And among those kind of barriers or issues that were taking these children away from their homes, one was the ignorance of their parents, poverty, accessibility, availability, and affordability of services that are education, health, social protection, and child protection related services. Those services were nowhere to be seen, and those that were available in the communities, parents were like ignorant to know about these services. And when we first came up with the data about how many children in need of education services, how many children in need of health services, and these other services, we could start with the training with the parents to help them get to know what it is that is available in their communities that they can make use of to ensure that their children's lives are improved, and parents kind of a network is enlarged in such a way that they get to know where they can get information from. So at the moment, what I would say is that when you have number of children that you have identified from within the communities, you refer them to where they can get appropriate services. And in the case of Rwanda, we have referred about 3,600 children to education. And this education sector means early childhood education services, primary education services, which is mainstream related services, and the special education services. And there are those that we have referred to the vocational training centers. But because of the issue related to affordability, accessibility of these services, we couldn't see them all going for those services. And we developed alternative kind of solutions to try tackle that challenge by making sure that parents of those children are grouped within the same parent support groups to ensure that they put the little fees together they have so that they can contribute to address some of the basic challenges of these children. And then as a result of that, the government or any other CBOs or NGOs were funding these parent support groups to ensure that parents will have some of the money they can use to take their children to school. And the second thing is that we kept on coupling this intervention with advocacy to ensure that those children with disabilities that are not going for school could at least be provided with assistive technologies that will allow them to go to school. And the third kind of intervention we coupled it with was the rehabilitation in the communities, because some of the children with disabilities were not going to school because they had some health and rehabilitation related needs. And we had physiotherapists in the field that were providing rehabilitation to these children. And after rehabilitation, there was then integration and then inclusion in the family and the community life. So those kind of interventions that we coupled with identification of these children's abilities and referrals helped about 140 children to go back to school. And this is in the ECD, in the primary school, and the special centers. So that's how I think this could be working together to make sure that children are getting back to their education field. Over. Thank you.
Thanks so much, Felician, for sticking within your time and trying to pack in quite a lot of information just within those 5 minutes. So thanks for that. Now I'll invite David to come in. And David, when you see my camera coming on, it means wrap up within a minute to close. Thanks.
Okay, thank you. So I'll be very quick. So we were able to support families using our active family and community support model, which offers a comprehensive and focused method for helping families in need. It provides access to and assistance with educational goals as well through the efforts of social workers and the community development networks. The community development networks are made up of community volunteers. So these community volunteers identify children who are not attending school and families who require support with improving their financial situation and accessing education. So most of the identified children, of course, are not attending school and are at risk of being placed in residential care in order to access education. We've also been able to support a children's home in Kampala transition into a community hub, which is focused on providing early childhood development. So the goal is to prevent separation within the communities. This also includes refugee families living in the area. So this early childhood development center now offers childcare and nursery services for mothers from the communities, allowing them to be able to work and support their families. Previously, these families struggled to find accessible, inclusive, and affordable early childhood education. And within this model, as the children are taken into the early childhood development centers, the families and the parents are also enrolled into some business training. So it takes about 6 months for them to be trained. And after these 6 months, when they received some business skilling, they're actually given a loan to go and start up a small business. And once this business is up and running, they actually start paying back this loan so that other members in the community can be able to also benefit from these services. We are also looking to partner with there's a partner called Learn to Play, which has a program from Botswana. And this focuses on using play and economic empowerment to support mothers. And they are referred to as mompreneurs. So this focuses on preparing children for school and equipping them with skills and resources to improve their economic status for better access to education. We know that our families cannot send the children to school unless they actually improve their economic status. So I just want to also note that this also includes support with families who have children with disabilities, as well as foster parents who have children that they are looking after. We also have a program and a partnership with Nyaka Global. This focuses on grandmothers. And this project focuses on developing foster and kinship care services to ensure that children can stay within a family environment while attending school. Okay, so education and academic achievements we know are central components of this program where we support grandmothers. We also talk about goals for education and how it also helps to prevent family separation. Within these grandmother groups, we have 60 members each, and we have a total of 16 groups across 2 districts. So these are over 1,278 grandmothers within the 16 groups and providing care to more than 3,800 children. Our baseline data, I'll share a bit about this, shows that approximately 72% of the grandmothers serve as the household heads and breadwinners, and the majority of the household members are actually children. So we've seen that it is evident that only 28.4% of grandmother households are currently living above the extreme poverty threshold, and 22% are living in ultra poverty. We started this program just over a year ago. So this is the baseline data that we are looking at, and we'll be very interested to find out how this is actually playing up, and we'll be able to share that data with you as well. So this highlights the need for urgent economic empowerment across the board and with the grandmothers, and to bring about transformation within their households. What we are doing with these interventions is we'll have a mix of microfinance services that includes savings, loans, and as well as also financial education and other sustainable livelihood interventions, looking at agriculture, livestock, as well as skilling to be able to support these families. Okay, thank you for listening to me. I send it back to you.
Merci de votre écoute. Je vous repasse la parole.
Okay, thank you so much.
Merci beaucoup, David. C'était intéressant. Maintenant, un peu long, mais des remarques intéressantes par rapport à votre système.
Sorry, Leon, sorry to interrupt. Just 1 second. I think
Alors, Léon, il y a
there
un
is a
problème.
problem with the interpretation because I think the interpreter's in the English channel rather than the French channel. So people may not be able to hear what you're saying. So, okay, I think it's been corrected. Go ahead.
I hope it's sorted because it was also interfering with me. Okay, great. Okay, so yeah, so I was just talking about the interesting sort of initiatives both in Uganda and in Rwanda, ranging from community-based rehabilitation and community-based interventions and ensuring that services are available for all children, including children with disabilities at the community level, and which sort of helps parents and caregivers to keep children in the family rather than taking them away to institutional care. And the same in Uganda, also looking at skills support to parents and to families and to foster carers to sort of support them economically. And I think that also relates to the earlier presentation on social protection and care. We're now moving to the next question. And for the next question, again, I would request 5 minutes each to to respond to each of the two questions that are coming. The first question is to Oswald from UNICEF Rwanda. So the first question is to Mr. Butanda Shafik from Uganda, not from UNICEF Rwanda. Can you tell us about cases where children's homes masquerade as boarding schools in Uganda? Why is this a problem and what is being done to address this? Mr. Butanda Shafik, over to you. And again, when you see my face appearing, it means you should wrap up. Thanks.
Thank you, Mr. Moderator, for moderating this session. My name is Butanda Shafik, Principal Probation and Welfare Officer, Minister of Gender. My question is about why schools are masquerading as, why children homes are masquerading as children homes, and why is it a problem? I want to say that as we are sharing now, I'm in a team of about 10 people in a district called Mukono, where we are assessing children homes, about 25 of them. And why are we assessing them? It's because they are unapproved. They are not known by government of Uganda. They are not regulated. And what I'm discovering in the field is that there are many schools within Mukono that are at the same time working as children homes. You go in a facility, you ask them, is this a home? They tell you we are a school. But we have done it in such a way that in our team, we have an inspector of schools. So the moment they mention they are a school, then the inspector of schools now engages them on what makes them a school. So why are they masquerading as schools yet they are children homes? I want to say that one of the reasons is that many of them don't know the law about the operation of children homes in the country. Then secondly, there are those who think that running a school is more actually friendly than running a children home, because in the country here we are insisting that children should stay in their families or stay with foster parents or next of kin than staying in children homes. So they prefer hiding children in a school, a boarding school, and yet it is a children home. Why is it a problem? We are seeing it as a problem because the law governing a school in this country is not the same law governing a children home. The laws that govern a home, especially the approved home rules, set certain standards that we want to be seen. And yet the laws that govern a boarding school also set certain standards. So it becomes a problem for us, people who enforce the law, people who want to ensure quality of service delivered to the children. Then two, I'm also seeing it like people use orphans and the children to mobilize resources. And the intention is not actually not to support the children, but the intention is to build schools, because in Uganda, school is a business. If you have a good school that is providing good services, it becomes easier for you to make money. So to me, someone who runs a children home in the guise of a school, I see him as someone who is exploiting the children. Then three, what I'm seeing in the field is that where you go to a school, like yesterday I was in a school called the Future Diplomats. Majority of the children, about 300 of them, were children who were paying school fees. And in this school, we had about 15 children who are under an orphanage within a school. So the attention is more on the children who are paying school fees than these other children who are orphans. So to me, I see it as a problem. Then as a government, you are aware that ours is to regulate, ours is to inspect. It becomes hard for Minister of Gender to go and ensure standards in a school that is governed by Ministry of Education. So you are trespassing on someone's boundaries. So we are currently looking at how do we ensure that we close that other section of the section of the children home, and we only leave the schools to proceed. So at the end of the exercise that we are closing on Tuesday next week, we shall come up with reports that we shall give the local governments to ensure that they implement. And our position as of now is that we don't want to see a children home within a school. Thank you.
Thank you so much, and also for really helping us to save on time. But quite important reflections there in terms of the policy and regulatory environment and how the cross-sector issues are quite important between the education and the child protection sector, and also how, you know, if there is weak regulation, there could be potential, right, for opportunism on both sides, either from education institutions taking advantage of, creating a home within a school, or of a home creating opportunities for making money, right, and bringing in sort of a hybrid of a children's home and an education institution for fee-paying children. But really quite important, and I think we are all seeing lessons and entry points here for both education and child protection sector work together and to address this. Now, the last question is to Oswald to tell us what is being done within UNICEF Rwanda to enable better coordination and collaboration between the child protection and education sections on care issues. So over to you, Oswald, and again, 5 minutes. When you see my face on screen, you need to.
Yeah, thank you very much, Leon. I'm Peter Oswald. I'm working with the UNICEF country office, like child protection expert. I want to talk about coordination on child care and education. In Rwanda, there is one government institution mandate to coordinate about disability inclusion. Is called the National Council of Persons with Disabilities. I worked with the National Council within 10 years as the Director of Economic and Social Empowerment Unit. I was in charge of coordinating all project programs related to empowerment of persons with disabilities. And now I'm within UNICEF in charge of coordination of disability intervention across the country office. So UNICEF is supporting other sister UN agencies in Rwanda to better understand disability inclusion of disability at all levels, from policy, programs, interventions, budget, M&E reporting, and indicators. So that's why UNICEF is the champion on disability inclusion in Rwanda, 1 UN. So we do appreciate. Especially Leon is the overall disability coordinator within UNICEF country office. So in order to properly coordinate disability interventions, I was recruited to support him to ensure that all country office programs, project interventions are disability friendly. So as UNICEF doesn't implement, we do support different partners, including the government, international NGOs, local NGOs, private sector, and so on. In the government, we support the government institution called NCPD to ensure that all local government understands disability inclusion, from the community mobilization to ensure that all children attend schools, to support those vulnerable children, especially those who have health problems, so that they can get better health services. We also work with another government agency called the National Child Development Agency, called NCDA in brief, so that it may have its social workforce at the community level, district level, or county level, and at the national level. So with those two institutions, we work to ensure that the children are well catered for through different social services. We also work with the different international NGOs to ensure that the UNICEF-funded projects are disability inclusive in the health sector, in education, if I can use sector, but section, in the health section, in the ECD and education section, in the social and behavior change section, in the CAP section, in the child protection section, and social policy section. All of the sections, we have currently integrated the projects whereby we support different partners, mainly Chance for Childhood, to identify all children's disabilities in pilot districts, Huye and Bugesera, and also to gather their parents in a parent support group so that they can know each other, they can be supported each other, but also they know how to transfer or refer their children to get better services. We also work with the rural government through NCPD to ensure that the whole community understands the real challenges on how to take care of the children's abilities by implementing community-based inclusive development, or CBID in summary, so that at least those children who have some cases can be supported at community level. So throughout these coordination aspects, we have monthly coordination meeting at UNICEF level. We also have a stakeholders coordination framework whereby we invite our partners to discuss on project development, but also to discuss on other emerging issues and disabilities. We also work with the local government, especially in those pilot districts, to know the progress of our funded projects and also support them to make sure that they really implement the projects by knowing the target. So here, the target is not all children, but some children who have disabilities and who need to be supported to have a better life. So in summary, that is what we call coordination of disability intervention within UNICEF country office. And we do thank our panelists and the other colleagues online. Thank you very much.
Okay, thank you, Oswald. I will not summarize much, but I think again quite important reflections in terms of the importance of cross-sectoral coordination and particularly working across sectors between, in this case, child protection and education, and making sure that there is that synergetic planning and bringing in government and other partners that are working in the same space to sort of plan together and address the needs from the community from an education point of view, and addressing the barriers that often result in children being moved away from the communities to institutional care or other education institutions, simply for them to be able to access education. I will not take much time trying to summarize and hand over back to Nicola for moderation on the question and answer. Thank you. Over to you, Nicola.
Thank you so much, Leon, and thank you everyone for this really fascinating exchange. I'll hand it over to Emily to facilitate any remaining discussion. We have seen some exchange in the chat box, but nonetheless, maybe some participants would like to comment at this time. So over to you, Emily.
Thank you, Nicola. We only have one question in the chat box, and if anybody else has any questions, perhaps you could pop them in the chat box or raise your hands if you'd like to ask them. I'm just going to repeat that question. It was answered in the chat box, but just in case it hasn't, you haven't been able to see that answer, because it was a good question, and it's for Mr. Umbai from Kenya. What evidence does the DCS rely on to support the success of these cash transfers in keeping children in nurturing families? Or are there different standards of success? So Hudson, I don't know if I think you're still with us. Are you able to provide an answer to that question? You may have left the webinar.
Hello.
Hello, yes. Thank you. Could you just, I know that you answered in the chat, but maybe you could just also provide an answer to the question verbally in case people missed it in the chat.
I think I said that was a good question.
Mm-hmm.
The country, remember we started implementing cash transfers from the year 2005, and we've had several evaluations, both internally and externally, just to help us understand whether we are getting it right. Mm-hmm. If we are getting it wrong, then we need to do some improvement based on the manual, because the manual is describing how we are supposed to undertake this cash transfer. So yes, we've had several evaluations, both internal and external, just to help us shape the cash transfers implementation in Kenya. I think that would be my response. Thank you, and over.
Thank you so much. I think that's all in terms of the questions. So I'll hand back over to you, Nicola, just to wrap up.
Thanks so much, Emily, and thanks really everyone for the really fascinating discussion today. Clearly, there's lots more for us to unpack further, but I think this was really a rich exchange, particularly in regard to the very concrete country examples, and really looking forward to the next steps. But we'd in particular like to thank all the speakers today. So Mr. Ibayi, thank you so much for jumping in. Suzanne of Cindy, Oswald of UNICEF Rwanda, Felician of Chance for Childhood Rwanda, David of Child's Eye Foundation, and Mr. Butanda Shafik of the Ministry of Gender, Labour and Social Development of Uganda. We will have a short poll at the end of this meeting that we would greatly appreciate you completing. You'll see it on your screen now. So once again, your feedback to us and for us to really have a clear picture of the participants in the webinars that we're convening as part of the regional learning platform is really critical to us. So many thanks in advance for completing the poll. And above all, thank you so much for joining us today. As you know, this webinar has been recorded, so we will be uploading it to the learning platform so that it can really be a resource also beyond today. And we look forward to the next steps. And I'd finally also would really like to thank Emily for all the great work in convening all the great speakers that we were able to listen to today. So with that, thank you very much, and we look forward to soon welcoming you to the next webinar. We will be in touch, of course, with an update via the newsletter in terms of the next webinar and also interactive workshops. Thank you so much.